welcome everybody, and thank you for joining us. I will, so HappyOrNot is the sponsor of this webinar, and you know, in this day and age, we are bombarded with you know, paper surveys, complex digital surveys, receipt surveys, and so forth. These two gentlemen here who founded the company, Willian and Heikki from Finland, felt that there was a need and discovered that gap, and we're going to be talking about that gap measure in the presentation today, or more importantly, Bill will be able to. The company was founded in 2009, and they were started in Europe, and subsequently we've launched. Now we're in over 100 countries, about 2,500 customers, with about 300 of those customers being in healthcare. So we have done quite a bit in the acute healthcare and long-term care world. But as you can see here, HappyOrNot takes a very unique approach in that point of care feedback. And hopefully today you'll be able to learn a little bit more about that and understand what we can deliver to the marketplace. And just to sum up, HappyOrNot is definitely a lot more than just gathering that data, but utilizing that valid data to improve operations. So it's all about timely collective data collection for corrective actions. Here's an example of some of our healthcare customers. Again, we have about 300 healthcare customers globally, and definitely looking forward to working with more customers as we move forward. With that being said, I'm going to introduce Bill Quinn, who is the Director of Project Planning and Implementation at Desert Oasis Healthcare. Bill and I have worked together for a couple of years now. He is a very experienced leader in healthcare programs and systems for the further development and deployment of solutions. He also utilizes Lean Black Belt, which is evidence-based practices to improve the alignment of patient experience with healthcare delivery systems. He has, along with other systems, utilized HappyOrNot as a tool to improve that. So without further ado, Bill, I will pass it on to you.
Hello, everyone. And thank you, Jason, for the opportunity to share our experience. As Jason said, I have been involved in healthcare for quite a while, getting close to 40 years, I'm proud to say. And I've lived through a lot of transformations in healthcare as the systems have evolved. But like most people in healthcare right now, Desert Oasis Healthcare, which is located in Palm Springs in Southern California, we were faced with the changes of a shift in looking at quality as measured by how it's defined by the provider or from the administration, shifting to the patient's perception. It's no longer about quantity or quality just as measured by volume. It's a true shift to perception. And so, like most other people, we were faced with, you know, how do you measure that? How do you have a valid way to pick that up, because perception is impacted by so many different things? So the other part of the environment was, as most healthcare providers, we are not a hospital. We're a combination of a medical group, a large IPA group. We have about 150 providers, 250 specialists, and then we also have other services like hospice and home health, palliative care, immediate care. We have a full spectrum of types of care in the community. We need to find solutions that would help us impact our star rating. In 2015, our CAP score, I think most people are familiar with that, was added to, but it was trending toward a 1. And we knew that as an organization, we needed to do something. We hadn't put the measures or the practices in place to impact patient perception. even though one of our most sizable subgroups of people, senior patients who are involved in Medicare Advantage programs, love their providers, but our scores on our third-party surveys were dropping. And so we knew that we had to have something to measure the actual patient experience closer to the point of care. So that's when we began our journey of looking for, some way to measure. And paper surveys, third-party vendors just weren't doing it. They weren't picking up the subtle information. So that's where we were introduced to HappyOrNot, and I don't know how other people are exposed to it, but one of our lead nurses, our nursing director, was traveling to London. She came back from going through Heathrow Airport and said, I found this really cool device. I think it's part of our solution. And that's where we began our journey with HappyOrNot. So moving on to our challenge, as we talked about, we're not a hospital. So a lot of the tools that are out there are based for hospitals and hospital systems. Again, we have our own medical group, which is a staff model. We have a large number of IPAs that there's all the pros and cons of the IPA offices, where they're independent, and we don't do a high level top-down introduction of strategies of how they need to practice. So we don't necessarily have control of, here, use this survey. So we had to find something that picked up that information. What we're looking for was a comprehensive way to affect this whole environment. And moving on to that third bullet was probably the most important thing, is how do you impact cultural change? So what we did is that we looked out of what other effective systems were doing. We looked to Cleveland Clinic. We looked at Sharp Steely for models of people who had been doing it for several years, and took a comprehensive approach to training, the measures, where they look for their solutions, and we basically heavily stole from the effective people out in the community. We looked for evidence-based ways to impact this change. So we adopted a 9 standard approach. We call our system Service Excellence, and we have 9 standards that were developed by staff with staff inclusion. We also have, as part of our curriculum, we use the curriculum called Language of Caring, and that's a curriculum for both our providers and all of our staff are involved in a 18-month training on techniques for effective communication and listening skills with patients. We have started a staff recognition program, which ours is called Wall of Wow. It's an electronic system where all staff can get recognition for positive behavior to each other in real time. We also have a staff engagement process for, it's called Bright Ideas. So frontline staff, all levels of staff can give ideas for positive things to change. And then we also have an employee wellness program called Employee Success Program. And then, as Jason mentioned, I and a couple of other of our team are introducing Lean as a way of thinking for how we solve problems. All of those, along with HappyOrNot, are part of our plan of how we're changing culture. It's truly a journey, and all of these pieces are interconnected in a very positive way. You can't do one without the other. Our key initiative with looking at HappyOrNot was a solution for having transparent communication, transparent measurement, and transparent way of relaying the outcomes to everybody involved, to staff and to patients. So HappyOrNot was an important part of that stool, three-legged stool, that helped us put together a complete package. So the new approach, we did a brief pilot in 2015 with HappyOrNot. We did that for about 6 weeks. We liked the results almost immediately. Using the system was very easy, and I'll talk more about that later. But the whole process of contracting, setting up a pilot, and then getting information from the HappyOrNot team, or Jason's team, on ideas of how to actually use this, they were really quite helpful to help us determine how to locate these. Initially, we put them, the typical place you think by the exit doors. That turned out not to be the best place. So we played with that a little bit, and we found the optimal places for us in our different locations. But our primary places that we placed them were in our primary care, specialty care, and our immediate cares. And we've done a variety of repositioning based on how we're targeting at any given time. For us, you have the ability, as you can see in the picture, there's a place to be able to put a question for the day, for the week, whatever. Our personal strategy is we have 4 devices. We do all 4 of our locations with the same question at the same time, because we want to understand if there's any variability that's based on environmental factors, holidays, all that type of. It helps to mediate or reduce any of that kind of variation or variability. And initially, we shaped our questions after the CAP style questions, because some of our key issues that we were trying to address was access, time to care, wait times, did your provider listen to you? So we mimic some of those types of questions, and we present those questions in both English and Spanish on the devices every week. Training of staff was very minimal. I and my children can tell you, am not technically adept. I need their help to dial the phone sometimes. I'm not that bad, but I was the first user to set up the portal, to set up the questions. You can set up your timing sequences. You have full control of how and where to have your questions displayed. Very easy to use, and I can say that from my standpoint, if I can do it, anybody else can do it. I've now passed that on to, we have interns that help, and they're easy. They can easily set this stuff up and get it and generate our reports. One of the key issues with the HappyOrNot was all the third-party surveys and vendors that we use. It could take a month to 3 months, 6 months before we get the reports. By that time, our providers mainly, or our frontline staff, they're like, so what? So we got something negative. How is that relevant? What can we change? What was actually happening that day? And with the HappyOrNot, they can watch in real time what the behavior is and what the response is in any one of the service sites. So that has been an incredible feature that we just wouldn't be able to do by having somebody be a direct observer in an exam room, or some of the tablet solutions that we have access to. This just gave us real-time information, and that has been critical. So again, this new approach was part of our overall strategy. It's not the only part of the strategy, but it is definitely a significant part of how we collect the information about perception, and we feel pretty good about the quality of the information that we're getting back. So the outcomes. Our frontline staff were the easiest. As I said, one of our key nursing directors, she found out on a trip. She brought back, she was so excited about it, and most of the frontline staff, they got it, how to use this device. They liked that we were measuring. They liked that it was a cool device. They liked the simplicity of it. They just got it, and they wanted to be able to prove to everybody what a great job that they were doing. And this has just helped reinforce their positive behavior. Now, from the providers, they're a different group of people. They were more skeptical about this. The star ratings are built into their total package of how they're reimbursed. So, they were like, okay, one more measure that you're going to measure us on, and they weren't all that positive about that. But after they saw the dashboards that came out on a daily and weekly basis, and that the frontline staff were using them as part of huddles, they quickly were engaged in looking at those dashboards, because they saw that what was happening at the front desk, the back office staff, or outside of their office, they could have impact on that. So very quickly after this started, and I believe we were all really surprised, the providers asked to have, could the device be located by their office? And the way we positioned that was right outside of their office as where the patients would exit. So that was a great thing to see, and that's been consistent among all of our providers. It does help the frontline staff, and by frontline I include front desk, the back office folks, the nurses, assistants in that area, and the providers. They stay focused on this measurement, and they use it in their daily huddles. They have it on their visual management boards. We post it on our intranet, so everybody in the company sees it every day, what's going on in any particular area. The part that has been really great is we thought, okay, this would be a short-term interest. People will get bored with it after a while. You know, it's the new toy of the day. But our percentage of people who have continued to use it has been very high. We have them in high traffic areas, and the percentage of people responding has continually been high. And we measure that by as related to the amount of scheduled appointments the day or the pass-by traffic intended. And we've always stayed in very high levels of 30 to 50%. Consistently, and this is, I think, what has directly impacted the response of our providers, is we consistently stay in the mid to high 90% for satisfaction. And that's been great. That's what we knew from the patients that we've talked to before. This was a way to document that was actually what was happening. When people left, they were highly satisfied. It has had, in our first year, and again, part of a comprehensive strategy, we moved from, and for many of you, you know, the star rating is a 4-star, trending down up to a 3 last year. And we're very proud of, because that's a heavy lift statistically, with our comprehensive program and asking people and educating people about what the questions were. We saw that movement, and now we're at a 3, and we're hoping to be higher this year. So on to the impact. The device is fun. I can't say that enough. Our staff get it. They like it. People like the 4 smiley faces. It's highly visible. You can't get more simple than the little device that's pictured with the 4 smiley faces. The way that it's positioned with the question above it, we played with the font size and found the optimal level where people could read a brief question, walk by, and respond to whatever the question of the week was. The learning experience, what we really think is the most positive part of the questions, is connecting the person who's leaving the point of care, seeing their provider, with the question that the later will get on the from the third-party survey, that they remember of, like, oh, when they're asking that question about was I satisfied with the amount of time I waited, that was when I was at Dr. So-and-so's office. We think that that's probably the main association that has been impacted, is by educating people. Those questions relate to where I saw my doctor. That has had a positive impact on our third-party scores also. The way that this is set up is you have access to a portal. It's web-based. It's really user-friendly. And as I said, I can do it, so anybody can do it. It's just great. And then we give different administrators access to it. They can download their dashboards at any time. They can go in if they see that they're getting some negative scores or responses. They can go back into the report themselves. They don't have to ask anybody for a report, and they can find out, you know, the time and where something happened. And that's been a great use for our frontline administrators. They really like it. The reports in the dashboard are compared to a lot of other programs, they're just beautiful for their simplicity. They're well thought out. They ask the right questions. They display the right information. I take the reports. You can download them as Excel data or a PDF. Weekly, we take our reports and post the question on our intranet along with the PDF of the dashboards, and it goes out in front of all of our staff. Everybody sees it every Monday. We are now getting ready to do that also on our intranet, so that we're educating our patients that we take their input seriously and we're doing something about it. And we're also putting it on our, for us, it's called Context Media. It's our wall boards and our TVs, so that we put the question of the day, and also that, what our responses are, that we get, in the 90% for satisfaction. We want people to know that. So it's really easy to use that. We tied this in to our questions into our service excellence standards. We ask questions shaped from our 9 standards. We also have did a series of questions that were pulled from our language of caring, like questions like, did your provider listen to you and explain what they were doing while you saw them today? So we ask real targeted questions because we want to see if our patients are seeing the new behaviors that our staff are being trained. And again, you can be very nimble in the type of question that you're asking. It's also tied into our web-based staff recognition. We ask questions again now when an area has a highly successful or gets a really high score, we put that on our staff recognition program to say, hey, immediate care got a 99% today or last week, or, so we can use that kind of information to reinforce staff behavior in lots of different forums. Again, I can't overemphasize, it's just fun. Staff like it, it's positive, they love that they get such high ratings, and it's more palatable when to talk about, those reds that they got, what happened and what could they have done better, so we can build it right into the curriculum or to the service recovery efforts. Recently, in the last 2 months, we now get our administrators for each site, when we get either a pink or a red response, an alert, and we'll show this in a few slides, an alert goes directly to either the email or the phone for that staff person, and so they can be informed that something's happened, and they can go find the patient or the customer and do service recovery with them. Overall, this tool is just, it's very efficient. It's just very low maintenance, and for us it's been much more cost effective than some of the other tools, either to build it in-house or to adapt some of the other tools, even for some of the tools that we already pay for to be able to use them, some of our tablets and that type. We've chosen just to really stick with the HappyOrNot devices because it gives us the most bang for our buck. So just to summarize, our initial thoughts were, this is just way too simple. So when we looked at the CAHPS questions as our model, we put a lot of effort into having these complex questions, and you're really putting a lot of effort into, are we asking the right thing? Is it the right time? Is it the right place? And basically we overthought it. We're finding more and more that patients, regardless of their culture, their language, whatever, they get the 4 smiley faces, and because it's mainly their perception of what just happened in their healthcare experience, they relate to the green smiley face, a little less green, pink, and red. They get that. So we've actually moved back to more simple questions, and right now for the last 8 weeks, we've been doing a very straightforward question of just asking, rate your experience today. And we're finding that we're getting basically the same type of response pattern. So it's people's perception may not be all that impacted by the words that are there. So we've played with that a little bit, and we're learning from that experience. So for the portal, again, it's very easy to use. I use both the Excel level data when I do more long-term reports, like a quarterly report, but for most part, I just print the charts out and give them directly to our senior management team or to teams that are looking at it, like our quality committee or whoever, and they get it. They understand it, and they really don't ask for a lot more interpretation. We're learning the patterns of how our days and weeks go. The other part that has just been great is we have met or exceeded our ability to have transparent communication. We have frontline users that can go in and get their reports. They use them in their huddles. They print out these sheets. They show them on their phone if they need to talk to somebody. They've just found a lot of adaptive ways to integrate this into their daily business. So I want to show you a little bit of some of the charts that are actually in the system. Starting with the by hour in the upper left-hand corner, we know our patterns of the day for weekdays. We know that by 10 o'clock, 10:30, 11 o'clock, when things start to back up, and we know our hotspots, we get more reds. The same thing happens, if you can see at noon, when people stop for lunch or they're kind of wrapping up for the morning session, there's less satisfaction. And then revving up toward 2 o'clock, 2:30 into 3, same pattern. Things get backed up and people are less satisfied. So that's, we know our days. We also, in the next chart on the top right, you can break it down by all of your exact locations where the device is located. And for us, if you look in the 3 through 5, we break up our immediate cares because we know that weekday, week evening, and weekends are different there's different things going on with people going to immediate care during those periods. Our evenings for immediate care, as we get closer to closing, that last hour, people are more anxious. They may have to be transitioned to a different level of care, so there's less satisfaction. For the weekends, our Saturdays are our hardest days. They're the highest volume of the whole week, which makes sense because the primary care doctor's offices aren't open. So there's longer wait times and there's more tension, and it tends to be because Palm Springs is a vacation town. We tend to have all the issues that come with vacation behavior on Saturdays on a Saturday. So we know some of the mediating factors, but this has been great. We can tell. Now the last one, that location is a shared primary care and specialty care site, and how this has helped us in that setting is we recently terminated a contract with our specialist group in that building because that's where most of our negatives came from. And while that wasn't the only thing that caused that, we knew that because they weren't engaged in our total service excellence training, they didn't have the best customer service skills. And because we're putting a higher and higher importance on customer service, it impacted that contract, and it's been recently terminated. By weekday, we know our pattern also. Tuesdays and Fridays are again, those are high volume days, less satisfaction. And then as I referenced earlier, the last report, the email alert, this is what you actually get. It tells you the location, and you get the response within 5 to 10 minutes from when the event happened. So that goes directly to the administrator's home. We've added to our devices a clear plastic business card holder, so that and with a note, please take one if you want to talk to somebody. And since this alert, we put up signage that if you give us a red today, please stop and let us talk to someone before you leave. So that's how we're doing our service recovery, or adding into our service recovery using this tool. And it's been very, very helpful. So in summary, we have just been very happy with this experience. We get great customer service from Jason. Just recently, we met some of the principals in the company. Jason has just been great. If there's something going on, and again, I've not had this level of service with other vendors. Just last week, week before, you get messages when the battery needs to be changed in your device. Apparently, I wasn't responding fast enough, and so he gave me a call or an email to say, Bill, change the battery in your device. So I was able to notify the people that needed to change the battery. But that's the level of service that you get with them. They've been very helpful, been open to our ideas to be able to further improve or just to ask the questions of, how to use this best. So for us, it's been great from that level. But really, the impact on our patients and our staff has been great. The momentum and the willingness and eagerness to learn from the information on a daily basis has not waned. And that's been great. We've been able to change it up enough, ask new questions, relocate it, so that a lot of people have been involved in this, and they see it as a positive initiative. So what we're looking at right now for our next steps is right now we're doing a targeted study in just our immediate cares. It's where we happen to get the highest levels of dissatisfaction, and that's a combination of things. Some of it's staff, most of it is because of the anxiety level and stress levels that people have coming into a full service immediate care. Our service is to divert people from emergency rooms, so they come in fairly complicated, painful types of conditions. If they're not, recently, we had a huge wave of flu in May, a little late this year, but May into June, and so we were backed up in our immediate cares. Well, it made sense that we had a lot of people, dissatisfaction was going up, but it also allowed the director for immediate care to change her staffing and get some additional people in when she saw those kind of things happening. So we're able to use it in that way. As I said, we're trialing a really simplified question. Our next step is to try it with no question and just see how that impacts people's response. And then the final big part that we're doing is we're moving the outcome information onto our internet with an education series of, here's what we've identified in areas, and here's what we're doing to address the access issues or the dissatisfaction issues. Our next big area is we have not introduced this into our independent physician offices, our IPA offices, but we want them to consider getting the device that we would manage it centrally and be able to expand this program greatly throughout the whole organization. So with that, thank you.
Thank you, Bill. That was a very thorough presentation, and thanks to everyone who posted some questions. I just want to remind everyone this is the best time to post any other questions in the chat box. You can locate that in the dashboard where it says chat, and feel free to just type in your questions there. Our first question is to Bill. We lost you there for a second. Are you able to go over the positive influence that you experience as far as how it correlates with your star rating?
Well, we believe the biggest positive impact of these devices has been having the CAPS questions or similar types of questions at the point of service when the person's leaving the doctor's office to say, when they're asking about wait time or did the doctor listen to me, those types of questions, that people are associating that question with the point of service where they're getting the care. So that 3 weeks later, or however long it is, when the third-party vendor contacts the patient to ask those types of questions, they're relating that question that's being asked in that survey back to their provider. There are a lot of intervening factors after a person leaves the doctor's office, like they maybe go to the community pharmacy and their medication's not ready, or they have a bad experience with something else, and perception is highly influenced by the last bad thing that happened to you. the survey asks about your interaction with your provider. So we're seeing that as having a positive impact on people's memory of where that question is being asked about.
Understood. So perception is key. All right. So the second question is for Jason. Jason, are you there?
I'm here. Can you hear me?
Yes. Okay, great. So Jason, I got a question here. It says, I'm worried that kids or employees might press the smileys repeatedly. Does that affect the results?
Great question. So we have developed a misuse protection that's built into HappyOrNot devices. It's actually customizable per device. So if you have multiple devices, you can actually have them set differently. But what we will do is filter out multiple responses. So if someone decides that they want to let you know 10 times that they had a good experience or bad experience or something in between, we will filter out the remainder so your reporting has the initial response and not the multiple responses.
Okay, thank you for that. And the second question is for you as well. What sort of question should I ask for the terminal or the smiley terminal?
Yes, we get this a lot. So, in healthcare, as Bill has described, they started with utilizing some more micro specific questions, and now we're going to more of a macro approach, and that works for their facility. The great thing about HappyOrNot is that it's customizable for your facility, whether you're acute care, you're outlining clinics, your laboratory, your emergency department, senior living, what have you. We have the ability to work with you to aid in drafting up questions that are specific for your need, because as Bill has elegantly described, what's going on in your facility with your agendas and your systems may be different now and different in 3 months from now. So it's hard to answer that. I guess the point is we work with our clients to help form those questions to make sure you have the right question being asked in the right environment at the right time.
Right. So besides quality of care kind of questions like please rate our quality of care or visitor satisfaction, how satisfied were you with your visit, or anything to something a little bit more granular like their waiting rooms or their practitioner professionalism, we can always accommodate those questions, yes?
Correct, exactly, and that's a good point. We have facilities asking anywhere from rating your courtesy and respect to wait times. Pharmacies are a great example of wait time issues, and that's a specific need for that type of environment. Therefore, with HappyOrNot, we can deploy that with that question to be able to survey the patients and engage with that specific pain point. And vary it between that and friendliness of staff, check-in procedure, clear and concise instructions, and then don't forget the employee satisfaction as well. Obviously, happy employees, happy staff equal happy patients. So there's also that correlation between the two. So when you think about the questions that can be asked for patients, also think about the correlation between the staff satisfaction with the patient as well.
Very good point. Thank you for bringing that up. All right, so we are running according to time. So what we'll do is we'll just do one more question. And the last question is to you, Jason. The question is, okay, this sounds expensive. Can you tell us roughly how much this system costs?
Yes, definitely. As Bill has mentioned as well, this is a very economical tool. So we try to deliver the best value at the best pricing as we can. So what we've done is we've put together a very cost-effective subscription model. And with that subscription model, you get the hardware is actually included with that subscription model, along with training, support, warranty. We don't hide any fees. And with that being said, we do offer term and volume discounts. But for a starting point, you're looking at under $100 to start with our system. $100 a month to start with our system. And we do, like I said, we do work with organizations for term and volume discounts.
Okay, thank you so much, Jason. And if anybody would like to expand on that question further, at the bottom of the slide there, you have my information. You can reach me on my mobile or my email, and I could fill those questions out besides the ones that were asked here, or if there's any question that arises later on. So with that said, I would like to thank everyone for attending Filling the Patient Satisfaction Measurement Gap webinar. A special thanks to our moderator, Jason Hish of Xavier Solutions, and our very special guest speaker, Bill Quinn. Thank you so much. Our team will follow up with you after the webinar, or you can visit www.happy-or-not.com for more information. You can also contact the team there. On behalf of Happy or Not, thank you once again, and have a happy rest of your day.